Thank you so much, Dean Delaney, for this invitation, which is a true honor for me to get to address the wonderful graduates of the class of 2019, your families and friends and wonderful faculty. And on behalf of the public health community and the healthcare community in Minnesota, welcome and congratulations. And I just join my colleagues up here in thanking you for what you are committing to and for the leadership you are going to provide to our state, and we hope you stay in our state, but wherever you end up practicing. You've already made a big achievement as exemplified by all that we've heard about the work that goes into achieving these degrees and the fact that you are signing up for such a critical, pivotal role in one of the most important sectors of our state and our nation's work is a testament to you. I want to thank you, too, for the opportunity to be here on the occasion of the 110th anniversary, I understand, of the School of Nursing, and congratulations, Dean Delaney and faculty. We are so blessed and proud in Minnesota to have the School of Nursing as a key partner in improving health in Minnesota and beyond. You may know that the World Health Organization actually has designated 2020 as the Year of the Nurse, in honor of the 200th anniversary of Florence Nightingale's birthday. Now, despite her focus on hand washing and healthy living, Florence is not physically still with us to celebrate this occasion. However, her spirit and her influence are still very much with us today. In fact, to me, it's quite remarkable to think about and learn more about the challenges she took on in her career and the relevance and the salience those same issues have for us still today, albeit within very different contexts. For example, she's widely praised for her work to bring a higher level of quality and professionalism to nursing. Up until that time, the role of the nurse had too often been filled by unqualified and poorly trained people in hospitals that kept the sick in unacceptable conditions. I will just note as a sidelight, the same could be said of physicians back then as well. She, Florence Nightingale, championed reforms in not only education, but nutrition, sanitation, hygiene, other factors that helped dramatically improve care and reduce infections and deaths. A prolific writer, she worked hard to spread her knowledge of how to provide better care for the sick and injured. To make her work more accessible and persuasive, she even incorporated into her work what today we might call infographics and plain language. Although she personally came from a very comfortable upper-class background, she did not hesitate. Indeed, she sought out opportunities to explore for herself the darker and dirtier corners of her world and to advocate for those who had no choice but to live in those places. One of the things that I find particularly far-sighted about Florence Nightingale is that she did not just focus on internal improvements within health care. She recognized that for improvements in health and well-being to persist over time, we needed to change how the larger society, and she took a real advocacy role in trying to change how her society at that time thought about health and health care. She combined her technical knowledge and her communications ability to explain to political leaders and government workers what changes in the system were needed in order to boost health outcomes for those receiving care in British facilities. And she passed along that knowledge by mentoring other nurses, including some who came back to the United States and helped to make dramatic improvements to the care received by soldiers during the American Civil War. Florence Nightingale was a transformative figure of the 19th century, and I'd argue that her combination of technical skill and zeal for reform remains a useful model for how we can make changes and make things better in our own ways as we head into the third decade of the 21st century. You're entering this field of health and health care at a critical time when we are grappling with complex challenges within public health and within the clinical healthcare sector. Our country is obviously still struggling to determine how to deliver health care in a way that actually maximizes health, but is affordable for our society and achieves more social justice than we have managed to do thus far. We're trying to figure out how to turn the curve on perplexing societal challenges like obesity, youth vaping, and antibiotic resistance, while knowing full well that many of the driving factors lie outside the boundaries that we've traditionally drawn around health and health care. Dr. Jones-Webb already mentioned the importance of nurses fully understanding the broader context of the social determinants of health. After all, how much good are we really doing if we tell people they need to make healthier food choices, but we don't also do something about the fact that many people suffering from obesity and diabetes do not have realistic access to high-quality, nutritious food and can't afford it even if they can find a store in their neighborhood that sells it? How much are we really doing if we encourage people to wash their hands and cover their coughs to avoid passing along illness, but we make it next to impossible for food service or childcare or even healthcare workers to stay home when they're sick? And is it worth our time to educate high school kids on the dangers of vaping if we don't also acknowledge and address the anxiety, depression, and other mental health challenges they're trying to medicate with that e-cigarette? These are the kind of uncomfortable questions I think Florence Nightingale might be asking if she was still around today. And I think they're the kind of questions we need to ask if we really want our communities to be healthier and our healthcare system to be sustainable. Unfortunately, we're running out of time to resolve these questions, at least if we are to do so before we have preventable and almost incalculable damage in terms of health lost in our society. Minnesota, for our part, has long been known for being among the healthiest states in the country, and indeed that's true on average. But in recent years, we've been slipping. Every year about this time, the United Health Foundation releases an annual report that they call America's Health Rankings. What you see when you look at the most recent data just out in the last week or so is a mixed bag. We, in Minnesota, lead the nation in the fewest cardiovascular deaths per capita, but we rank among the worst when it comes to excessive drinking. We rank second in the nation in fewest premature deaths per capita, but we rank 46th for seniors who have a dedicated healthcare provider. We have the fourth lowest rate of low birth weight infants, but we're third worst for immunization rates among children in the earliest ages. Minnesota dropped from 6th to 7th in the United Health Foundation's state rankings in last year's report. We have perennially been in the top 10, but we've been first as recently as 2006. So we don't like the trend that we're on. And we'd like to see Minnesota get back to the top of these state rankings. But even more important than these rankings on average are factors that the averages don't capture. Among the most alarming and unacceptable for those of us in health and health care are the metrics showing our continued challenges with health disparities. It's in just about every health issue, every health statistic you care to look at. The distribution of results, of outcomes, is not equal, it is not equitable, and it must be addressed. There's actually a term I learned from one of my university colleagues about the Minnesota paradox, that not only do we have large racial gaps because the averages are so high, our populations of color and indigenous peoples suffer worse health statistics than their peers in other states. So it isn't just that our averages are high, it's there's something systemic in our system that is creating even worse inequities here in Minnesota, where we want and strive to be the best than is true in other states. So to bend the curve on all of these issues, we need to tackle several big challenges. These include protecting Minnesota's children and families, including doing much more to make sure that our youngest Minnesotans, all of them, get off to a healthy start. We need to make it easier for people to make healthier choices about diet, exercise, and tobacco. Still the big three, the choices that we know lead to reduced rates of chronic disease and fewer hospital visits. But we know that people don't make those choices in a vacuum. The community conditions in which they live make all the difference. Addressing Minnesota's homelessness challenge and the closely related challenge of ensuring that we have a mental health care system adequate to the needs that we see in so many places, in so many communities in our state, and continuing to work more deeply with communities to understand how they experience these health issues and what solutions to closing health inequities will be most appropriate from a community-based perspective. These really are big challenges, and they can be overwhelming in their size and complexity. When you really start to understand the importance of social determinants, it can be hard to know where to start. It's too much for any one of us individually. In truth, it's too much for the government, for universities, for nonprofits, or businesses to solve alone. It will take all of us. The way to accomplish these things is by building partnerships and recruiting more Florence Nightingales to advocate in 1,000 different ways, in 1,000 different points in our vast health system. And I can't imagine a better group of people to join us in this work than all of you here today. As nurses, you're going to be, as Dean Delaney has said, on the very front lines of healthcare, delivering both primary and specialty care, serving in a whole variety of roles to improve the system as well as to deliver excellent individual patient care. You are going to be, as we know, really the heavy lifters in the system, the people and the professionals that patients and families experience the most, the friendly faces, the helping hands that people remember more than anything else after their encounter with the healthcare system. Just on a very personal note, part of why I was so honored to be able to be with you today is that just in recent years, I've had much more opportunity to experience the healthcare system, occasionally as a patient, but more so as a caregiver of family members. Having had lots and lots of experiences with the healthcare system, I can absolutely verify personally what I've always known intellectually. It is the experience with the nurses that differentiates the comfort and the satisfaction that people have with their care, and thank you. Thank you to your profession, thank you to you individually for being that technically excellent, but so important, compassionate, caring people that you are and will be. This is a very important and noble profession, and it will become only more important in the years ahead. 200 years after Florence Nightingale lifted up the craft of nursing into a real profession, we need it more than ever. The need for nurses is especially acute among our state's smaller hospitals and where our communities are aging, and also in the public health nursing workforce, which has critical need for new knowledge and new nurses. We know that the nursing workforce is aging, so it's especially gratifying to see people choosing to enter this field. We need nurses of all kinds, and what we need most are nurses who are not content to sit back and be content with the status quo. Nurses who know how to push in the right ways to make things better. You should expect to be at the table participating as key leaders, actively working and influencing policies that address health disparities, ensure access to health care, and achieve quality improvements. I encourage you to follow Florence Nightingale's example in asking the tough questions, looking for how things can be done better, putting the interests of patients first. I challenge you to help us change the dominant mindset that too often focuses on treating sickness to one that truly promotes wellness. As a former colleague of mine once said, our goal collectively should be to have the best healthcare system in the world and not use it so much. And just to reassure you that you're not signing up for an impossible task, it's really impressive to note, as has already been said, nurses are the most trusted profession, we know that. But nurses also have the highest rates of career satisfaction among Minnesota's healthcare workforce, which is a good thing. It's important work, it's tough work, but it's work that you love, which is such a necessity for a profession filled with gratitude and joy. The good news is that you are not taking on these big challenges alone. You have natural allies in us, in our public health system, from the CDC at the federal level, the Minnesota Department of Health at the state level, to local health departments and hundreds of nonprofit organizations and many more individual Minnesotans who recognize that we all have a role to play in building a healthier society. All of us in this room, I think, represent the best bet Minnesota has for meeting these big challenges and reclaiming our rightful top spot atop the list of healthier states, but this time for all Minnesotans. Minnesotans depend on us to make this happen, and I believe we can. I'm gratified, I'm impressed, I'm excited by the dedication and the talent I see in this room, at the innovation and the leadership of the School of Nursing, and each of you. I look forward to working with you as health professionals to help move the needle on health in our state. Thank you for choosing nursing as a career. Congratulations on what you've accomplished. Enjoy the celebration of the day, and most of all, good luck. Thank you.